So we will have a presentation of Ken Smetters and Alex Arnon. It will be about the modeling economic and health effects of COVID-19. AMDS is an Amsterdam Data Science is a network organization that tries to bring together academia, industry, and society. Amsterdam Medical Data Science, where we collaborate with on this meetup series, is the same initiative of trying to bring academia and industry together, but then in the field of medical data science. And luckily we have two amazing sponsors, Google and Elsevier, to make this meetup happen. Mark, would you like to introduce this webinar further?
Yeah, welcome. Thank you, Julia. My name is Mark Siebert from Elsevier. I'm working as partner manager here with Amsterdam Data Science and our other global partners. And I'm very happy to have another webinar in our series to learn about the impacts of COVID, especially looking from a data science perspective. And I think we learned already from the topic of modeling from an healthcare point of view, from an economic point of view. And I'm very excited that today we hear from the Wharton School about a model that actually brings those two worlds together. We had a couple of questions around that in the previous sessions. What if you can connect those perspectives? So I'm very excited to learn about that. So in that sense, I welcome very much Kent and Alex, who join us from UPenn, the Wharton School, and the Wharton budget model. And I think an interesting aspect I saw that you will speak about is the effect of, or the difference between causation and correlation. I was wondering recently when I was going out here in Amsterdam that since the Corona crisis started here, the weather in Amsterdam was dramatically better than I've ever experienced over the last 10 years. Mm. So I know it's probably not the cause or not the direct cause, although in the lunch talk we heard a bit of some modeling and exploration about the weather impact. But I thought that practically speaking might be an element to see if there are correlations or causations that might look like and probably illustrate a lot of ideas and thoughts around the challenges around modeling. In that sense, enough from my side. I'm very excited to learn more about the new capabilities we have from a data science point of view, but also the challenges that probably modeling brings with it. And would like to hand over to Kent and Alex. I think you will introduce yourself a bit, and we're very happy to have you here virtually. That's one of the benefits I think we have now in the virtual world to exchange the learnings and experiences across the Atlantic as well.
Great. Well, thank you very much for the invite. Really appreciate it. And I am Kent Smetters. I'm a professor at the Wharton School and the faculty director of the Penn-Wharton budget model. That's about 5 years old, and we do a lot of analysis for the U.S. government as well as some state governments. But part of that is, in fact, the analysis that we've been doing on modeling the coronavirus and health effects as well as economic effects. So I'll share my screen right now. I'll talk for a few minutes just to kind of set up the project, and then Alex Arnon, who is one of our data scientists, and John Rico, also one of our data scientists, is not able to join us today. He will, they both worked heavily on this project, really doing the major work on this project, and we'll hand it off to Alex halfway through, and he'll describe some of the data science aspects behind it. So hopefully you can see my screen. Let me know if there's any problems there. So every state in the United States had, like you see in Europe and lots of other places, had imposed some type of lockdown orders to stem the spread of the virus. And most states in the United States have relaxed what's called stay-at-home orders, as well as some restrictions on non-essential businesses and activities. Full relaxation is still in progress, and it varies from state to state. So, for example, the state of Pennsylvania, we actually have these counties, and they're color-coded between green, yellow, and red. Red meant stay at home. Yellow meant you could go out in public, but with some mask and other social distancing. And then green means business as usual. So reopening, of course, has some economic benefits, but also some public health costs associated with that. And so we really want to look at that in some detail. And so you can go to our website. We won't have time to do it right now, but the website link is right here. And if you want to, it's just as easy to Google Penn-Wharton budget model. And you can also do that. And I'll give you a general overview of it right here, but I won't spend a lot of time on it. In particular, you can look at a policy scenario, and that is baseline policy. And the definition of baseline simply means that states are maintaining the restrictions, whatever they happen to be at that particular policy date. In this case, it's as of June 23rd is our most recent update. So whatever it happened to be, actually this slide is from the previous week, but whatever it happened to be at June 23rd for that particular state, actually inside of that particular county, inside of that state. Some states still would need to, haven't fully lifted their stay-at-home order, so you can pick that as a scenario. Then also full reopening, kind of business as usual. But as we'll see is that it's not just state policy that matters, it's actually behavior that people choose to engage in. So what we call baseline behavior is whatever in fact is happening in that state, or in fact even at the county level, that we look at as of June 23rd, and that will vary a lot between counties, between states. Think about, open state like Wyoming is going to be very different than a state like New York, higher density and so forth. And then what we call reduced distancing. This is the idea is that we slowly go back to pre-quarantine kind of levels of personal social distancing over time. And so this is about behavior, not about policy. So you can think about baseline behavior is that if in fact people are meeting outdoors, they're wearing masks, they in fact are keeping a few feet from each other, versus reduced distancing, maybe they're meeting more indoors like they did in the past, and they're not wearing masks and so forth. We don't assume that you go to reduced distancing immediately. It's a log scale, but a lot of the action happens in the first few months. And then we look at various outcomes. There's an Excel spreadsheet that you can actually download to get even more results. But things like GDP, employment, reported cases, as you can also download things like infections, symptomatic, asymptomatic, things like deaths and so forth. And then you can select a particular state. You can play a little movie chart there. You can see how the dynamics will change through our projection window. Again, this slide's a week old. It was actually updated a couple of days ago, but you can in fact see how things are changing. And so Alex will overview the model in more detail, but we get a ton of data from lots of different sources as that we're showing here. And the idea behind this is that we want an economics framework to feed into the typical epidemiological type model. If you only have an epi type model, but you don't have the economics for feeding into that model, the problem with an epi only framework is that when you start to think about policy and policy changes, you're kind of forced into the more adaptive or myopic, sometimes called hammer and dance routine. The hammer is the quarantine, the dance is that you say, okay, we start to flatten a curve, whether it be on cases, whether it be on deaths, whatever metric that you're looking at. And then we start to relax and kind of see, is the curve still flat, or are we increasing at an exponential rate again. And the problem with that, it's very myopic in its approach. Instead, what we've done is we said, no, if you start to reopen for business, we can actually estimate what's the impact of reopening businesses on social distancing, on jobs, on GDP growth. And these will, in fact, feed into key variables, including the key variable, as we know in these epi models, is the reproduction number, sometimes called R or R naught. And so instead of having a myopic approach, we're actually able to take a lot of these key variables that are estimated typically at the daily level, right at the county level, sometimes at the zip code level, including industry characteristics, density of population, weather, as well as lots of other things that will affect key epi model predictions. And so we can now model those explicitly, and not only are we going to see the trade-offs between economics and health, but we can also, even if you're only interested in health, we can have a more prospective estimate of what is the effect of the policy change on health. And so some of the so-called second wave that you're seeing in the United States, we've actually predicted some weeks ago would happen as we start to open up for businesses. So the kind of the goal of this model is that you have kind of two types of models. You have the practitioner models, which tend to be epidemiological only models, and you're forced into hammer and dance myopic expectations. You have the academic models, but they tend not to give a lot of, I'm an academic, but nonetheless, the academic models often are not super as useful for policy at the actual state level, because they're not super granular. They're not giving you a lot of trade-offs in terms of actual estimates of cases, of deaths, of GDP, of jobs, and so forth. So we really wanted this kind of best of both worlds, much more granularity that for policymaking, but also taking some of the serious rigor that academic models give you, which is beyond myopic expectations. So from here, I mean, as you can tell, there's a lot of different variables that feed into our estimates of social distancing, jobs, and GDP. And so why don't we have Alex describe how those estimates are going to get created using this principal component analysis, and then how we do predictions with the diff-in-diff type estimates. So go ahead, Alex, and I'll keep the slides going.
All right, thanks, Kent. So we start out, we have all of this data that we've collected from various sources. All of it is at least daily frequency and measured at the county level or more detailed. But we have three problems. So first off, each of these variables contains some useful information about the thing that we actually care about, but none of them are comprehensive, and they all also are subject to their own idiosyncratic variation. Second problem is that because we are dealing with daily data at county level, and these counties can be pretty small in terms of population, often there's just a lot of noise in the day-to-day variation of any individual series. And then finally, we have all these components. Let's say if we think about GDP, it's easy to see we have many variables that capture some part of GDP, but because the composition of GDP and what drives it varies widely across the US, which series are important for measuring GDP is going to be very different across different counties. I think that's easiest to see if you think of a major urban center. Retail and restaurants are going to be really important, whereas industrial emissions would not matter so much for GDP. Whereas a county where most economic activity is manufacturing, their industrial emissions are going to be key for GDP. Retail visits, maybe not so much. So fortunately, there's a relatively straightforward solution to all of these problems, and that is principal component analysis. And so basically what we do is we just, we collect all the series that are relevant for social distancing or for GDP, and we take the first principal component. And so what that means really is we are finding the linear combination of all of the component variables that explains the largest share of common variation across all of them. And because we are doing this at the county level, each series is weighted differently in the linear combination in different counties. So that accounts for the heterogeneity and the composition of GDP. And then this also has the nice feature that it uses all of the series to identify and remove noise in any other series. So, and then, there's a second step. We scale these to weeks, to GDP and employment. And so now that we have our series, we want to know how much were they affected by policy and how much of what we saw in changes was just driven by non-policy behavior. So to do that, we estimate this difference in differences model here. This is a fairly standard event study design where the beta coefficients here are going to trace out the differences between counties that were affected by a policy and counties that were not affected by a policy over the 15 days leading up to and then immediately following the policy going into effect. And so we'll see what that looks like in the next slide. But the first set of betas here basically test for systematic differences between our treatment and control groups. And then the second set of betas are our estimated coefficients. And then we also include the number of COVID cases in a county. This is to account for just voluntary behavior changes. And then we include a rich set of county economic and demographic characteristics as controls. And this is really important for identifying the effects of policy as opposed to other things. For instance, a county with a lot of their employment in restaurants is going to see a bigger fall in employment regardless of what policy is doing. So it's important to control for that.
Yeah, and I apologize, there's a missing C here in the, but yeah, that corresponds to that C right there. Okay.
So in here are the estimated betas for social distancing. So the bars are 95, or the error bands are 95% confidence intervals. The y-axis here is the log of our social distancing index, and that's a measure of the contact rate. So a negative effect here means that the policy was effective in reducing contacts. And so, we can see that here we're considering 6 of the most commonly used policies across states in the US. For the most part, they did have significant effects on social distancing. But if we look at the scale, we see we're generally talking about reductions of 10 to 20%. Again, this is a log scale. Whereas we, in many places, saw cumulative reductions in social contacts of or like 75 to 90%. So the policy had a significant effect, but it is not the dominant driver of what is happening.
And just to make clear, this dotted line, and that separates the pre-policy and kind of post-policy period. What you're expecting to see in a pre-policy period as the model fits well is that you have a lot of randomness around 0, and then for all the variables. And that actually comes back to an earlier point, and that is things like weather or things like density. You want to be able to separate those out, but also the people were doing personal social distancing even before the policy came around. So if you actually saw a trend in the pre-policy period, you may actually only be picking up what people were already doing without the policy. So we want to be able to properly control for the fact that people are doing some personal social distancing before the policy came about in order to isolate the effects of the policy.
Okay, and so now we get to the link between the economic and behavior dimension and the epidemiological dimension. And here, this is a model that is the relationship between our measures of social distancing and the reproduction number. So here, this is how many secondary infections are generated by each new infection. Basically, how quickly is COVID spreading? So we estimate the time-varying reproduction number for about a week window at a time, and then look at its relationship to our social distancing index. And here we we've experimented with a number of specifications here, some more sophisticated than this relatively straightforward one, but it doesn't make very much difference. So we go for the more simple and interpretable one. And so here what we are doing is we are estimating the time-varying relationship between social distancing and R 10 days later. So this 10-day lag here is to account both for the incubation period, and then there's a lag between when somebody is actually experiencing symptoms and when they will show up as a positive test result and thus end up in our measure of R. So here, we are So I guess it's we originally did not have this time varying dimension here where the effect varies by week. And we found that as the data emerged, this time varying pattern emerged. So we can see what that looks like. We go to the next slide.
Okay, in fact, I'll skip this one just for a second and actually play this little GIF here.
Oh, wow.
I don't know if that's coming across well internationally, but you could see the relationship between R and the counter indexes, which is like the inverse of the social distancing higher. So when I explain this, and I'll go back to this slide. Now you can see it broken out by weeks, but go ahead, Alex.
Yeah, so the encounter index here is a measure of how much people are coming into physical contact with each other. And so that's what's plotted on the x-axis here. The y-axis is the reproduction number. And so when we, each of these is controlling for a variety of factors, temperature and climate effects, as well as county level characteristics. But when we allow this time varying relationship, we see that it is just getting steadily flatter over time. At least so far, we think, it's possible this will turn around in the future, but thus far the pattern has been that over time, the relationship between these two variables has weakened. And I mean, I think that is very intuitive. If you just look outside, you can see people are behaving very differently than they were in March. Going to the grocery store is a much different level of exposure today than it would have been in mid-March.
Right.
So this is also part of our, when we talk about behavior going back to normal, this is also part of what we mean is not just how much are people interacting, but how are people interacting.
Yeah, and just to give a little interpretation for the same encounter index, notice that the value of R has come down quite a bit and this is on a log scale, so as you go up by 1, you're almost going up by 10 times. But what this is really saying is that for the same kind of group size, the same distance within the group, how close people are standing together, that the relationship, the contagion has gone down in effect. And you can think of this as we can measure group sizes, we can measure how close people are, but now what has changed is that now people are wearing masks. If people are, instead of meeting indoors, they're maybe meeting outdoors. Maybe there's now plexiglass between people in terms of transactions. So we're seeing a lot of personal behavior is playing a big role in reducing the contagion factor. That's R. As you know, R is critical in all this. An R bigger than 1 means explosive growth in cases. An R less than 1 means that you actually have a chance at dealing with all this. Okay.
Okay, and then the last piece here is the actual epidemiological models. So this is, we start from the conventional model of epidemiological dynamics and then augmented in a number of ways to match the characteristics of COVID. And so, we can talk about this in the Q&A if people are interested. I won't go too much into the details, but, it's people move through these various compartments. Wherever possible, we use clinical parameters, biological parameters of the disease, but especially in light of the uncertainty and how much estimates of those parameters have been moving around, that is relatively limited. So a lot of this is based on, the parameters here are based on what we have actually observed in the data over the last several months.
Yeah.
And these are, I guess, one thing that is somewhat different from most of the models that you see for this is we are modeling as independent or related but independent or separate state level epidemics. So here, there is a separate SEER model for each US state. And those can end up quite different because of the importance of behavioral differences in some of these parameters.
Yeah, and the typical SEER model, SIR model, is ignoring either some of the exposed, and so then people added the E component. Well, as we know, for this particular disease, the infected actually breaking out between symptomatic and asymptomatic is really important. Partly incubation period, but also some people will never develop symptoms, but they can still pass on the virus, as everybody knows. by now. So getting that right is super important. So just to kind of sum up the results so far, and again, you can go to the website and look at it yourself and try different combinations and so forth. This is kind of a summary table for the United States, and you can look at individual states here. Under baseline policy, again, that's each state as of I guess June 21st. I said 23rd earlier. I guess it's June 21st. Whatever the policy was in June 21st, that policy continues for that particular state. So again, it's not forcing every state to be the same. There's a lot of heterogeneity. And whatever the personal behavior is, that continues for that particular, in this measure at the county level and aggregated up to state. And we're projecting by roughly end of August, we'll have about 2,000 cumulative deaths. So that's at the deaths during this projection window. It's including deaths before this projection window. If we lift the remaining stay-at-home orders in various states, it has very little impact on deaths, only because most states have already lifted most of that. So there's not too many of those remaining. Full reopening, that means business as usual. If you wanted to go to sporting events, that would be allowed. Not that people would do it, and the deaths go up. But notice the big change is not so much the policy, it's the actual behavior of people now. In particular, as we go, so for example, if you compare this baseline up here of just current baseline policy, suppose policy doesn't change, but people just start reducing their own social distancing. Notice the deaths we project now will increase by 49,000. So we'll be roughly at 250,000 by end of August. But now people lift this, if we talk about lifting remaining stay-at-home orders or the other policies, and people also interpret that as, hey, I can be a little bit more careless. I don't have to, be as precautious. Then the cumulative deaths go up by quite a bit more. So it's really personal behavior is kind of the main takeaway here. Of course, less social distancing also means more economic activity. So we're going to have more jobs. And now just be clear, what we're projecting in this case is that on our baseline policy, we will get about 4.3 million additional jobs during this projection window. So this is not saying that we'll have 4.3 million more people employed relative to this point last year. Rather, what this is saying is that during this projection window, we've lost 30-some million jobs in the United States. We'll regain about 4.3 of these. But obviously, if we in fact reopen more for business, we will actually get more and more jobs coming back. And if people reduce their social distancing on top of that, that means they're more willing to go to restaurants and so forth. We'll have even more jobs. And this year-over-year GDP, we have to be kind of careful how we interpret this. This is literally saying as of the end of, you almost think about this as the last week, this week in August, the GDP that is produced during that week is about 4.4% lower than the corresponding week of a year ago, 2019. That's why if you fully reopen and people really do in fact reduce their social distancing, you're going to get a lot more economic activity here, and that is to be expected. Now, this is not saying that GDP from the beginning of 2022 and end of August here is going to be 10.8% bigger than it was, 2019, January through August. What this is really saying is during that technically day or week at end of August, the GDP in that week will be quite a bit bigger than the GDP in the previous August, that same week. And what this is doing is kind of making up for some of the loss. So on a quarterly basis, when you account for the losses that happened earlier in the quarter, we're still forecasting like others that, so this is us, this is another group in the United States, the government group called the Congressional Budget Office. Blue Chip and SPF are kind of professional forecasters, and we're all kind of similarly aligned in terms of our forecast of Q2, Q3, and then eventually Q4. So definitely, and that's taking into account the GDP that was lost kind of earlier in the quarter. So, you know, we could talk about policy beyond of what we've other stuff, but I think, you know, for and you know, so there's more slides in the slide deck. I have an appendix back to how to think about, you know, some of the quarantine and so forth. Feel free to kind of peruse through that. I believe you have the PDF for this. But at this point, I think we're just going to pause and we'll throw it open for Q&A. If it's an easy question, I'll take it. If it's a hard one, Alex will take it, and we'll kind of go from there.
Thank you for your presentation. So I want to prompt everyone that everyone can put their questions in the Q&A section. We already have 2 questions at this point. I would like to ask one question from Linda Hartman. Is it clear in the data when it is collected as opposed to when it is reported? For example, in the Netherlands, there was a 1 or 2 day lag in the reporting of hospital deaths, which skewed the more recent data to the predictions based on newest data lagged behind.
Okay.
So unfortunately, no, it is not clear. And there is a lot of heterogeneity across states and even sometimes within states across counties in how they report this. So there is a whole step we didn't talk about, which is essentially we pull all the different sources of COVID data that we can find and do a little bit of, you know, essentially modeling to try and account for these differences, strip out noise and timing differences. So no, there is definitely some measurement error being introduced here from reporting differences.
Yeah, and the hope is a lot of that's random, but that's not always true either. In fact, some states are just known as better, and some states will report information. For example, what cause of death has always been a big issue in the United States, because as you know, as a virologist told me some years ago, you don't die from a virus, you die from symptoms related to the virus. And so how that gets recorded on death certificates is often a bit more random. That has improved dramatically in the last few months, mainly by government mandates to do more testing on death. But it's also one reason why when people do comparisons against the common flu, that those comparisons are often incorrect, because the common flu do not have the same kind of reporting standards as COVID has had. In fact, the federal government has basically given up trying to do good statistical data gathering across states in the United States about how many people die from the common flu every year. They try to use some sampling along with some modeling, but CDC is basically even says on their website that they've kind of the states are so inconsistent in how they report things like the common flu. But COVID has tightened up, but it's still, there's some heterogeneity there that is not always good. This also becomes a big issue when we talk about race and income in the United States. A big issue is that some states will report deaths by race, some states will not. Some states will also, when you die, the question is, where in the state did you actually, do you record that death? Did you, because in the case of like Pennsylvania, a lot of people come to Philadelphia when they're sick. So did they die in Philadelphia, or are they recorded in the county in which they actually live? And so given that we're trying to do stuff at a granular level, in theory, the law actually says they're supposed to be recorded, at least in PA, they're supposed to be recorded as the county that they actually live in, not the county that they actually die in. Not always clear that always happens.
In addition to this question, I think it's very interesting that you take into account the specific country specifics of how they register everything. Then another question is, how is it dealing with, is this easy to implement for other countries?
Mm.
I think that's building upon what you already were telling.
Oh, Alex can do it for any country. That's my... it really comes down to the data, I think, because the model itself is fairly If you had the right data, you could run our framework. And we've been approached by various countries, and we're happy that we'll be open sourcing almost everything pretty soon. But yeah, we're happy, would love it if other countries wanted to use the data, and you can, again, go fairly granular. It comes down to if the data is available. But Alex, is there anything specific to the US that outside of the data issue that you think of?
No, I mean, it's really just the data, you know, of having it at the disaggregated geographic level. And I mean, you know, I think you would need a fair amount of additional expertise in how other countries work. You know, understanding the relationship between states and governments here is an important part of what we're doing. But in principle, yes, it should be, the framework should be totally generalizable. I mean, you know, you could replace counties with countries and do it for the world in theory, although I think the reliability of the estimates at the national level is questionable.
Yeah, because things would get really aggregated at that point, and you'd want to get much more specific. And that is part of the value of going to the county level, is that we can figure out industry mix, even the age of the population that makes the demographics. A lot of those things, even weather, we can separate, you know, correlation from causation by figuring out density versus kind of weather. And so it turns out some of the epi-only models in the United States, we think they may place too much emphasis on weather, because it actually turns out a lot of the colder climate cities are also the most dense cities in the United States. And so separating that out and that economic activity out becomes really important. We still have a weather effect, but we think other models probably put a little bit too much emphasis on weather because of that failure to separate out. What I loved about the framework that Alex and John really came up with is that it also has some ways of kind of, that like principal component analysis, look at the pre-policy period. Do you actually see randomness around zero that you're expecting to see? There are kind of checks in there, at least in terms of the statistical side, that the time series, you know, gurus, Jim Stocks of the world and others would want to see before kind of doing any sort of projection going forward. And so those kind of built-in checks I think are kind of neat. That allows it to be kind of, you could then run it in another country and kind of see that those, at least those basic checks, you know, hold.
Okay, thank you. I think another interesting question is from Stefano. It's what method did you use to validate your model, or how did you do it?
So on the on the empirical side, the validation really is the statistical tests. You know, partly what Kent was just talking about, of checking the pre-trends and making sure that our treatment groups and control groups are, you know, are not systematically different before the policy goes into effect. You know, we do back testing, but unfortunately, this is mostly for the epidemiological model. We will, you know, run it forward for a period where we actually have data, and you know, how the parameters of the model are varying over time. There is no question that, you know, this is part of, I think, the advantage of a less structural approach, or maybe a reason a less structural approach is required here, is that we are just learning in real time about you know, how to set up and parameterize these models given the data that is emerging. So, you know, we try and test it, but basically, as long as there has not been a massive change in what is happening within a state, the model works very well. It projects outward, but obviously, you know, the world is just changing all the time in ways that we can't predict. So for many states, at any given point in time, the projections, you know, 2 weeks out may not match particularly well. But national, you know, the biggest errors are in the smallest states, as expected. So nationally, it's usually is not super important.
Yeah, and what I'll say is that this is a classic trade-off between, you don't want to have an overfitted model, obviously, that takes away so much of the variation from the structure that you actually think matters. So it's really tempting, like you could just random effects everything and just, you know, have controls through the wazoo, and then pretty soon your intercept terms are just swamping up almost all the variation. It has very low predictive power. So obviously, you want to, when you think about projected mean square errors, you'd love to be at that minimum. You don't want to underfit, you don't want to overfit. And so we we didn't talk a lot about it, about how do we do the treatment versus control, but we are trying to tie our hands pretty well because we're aware of that. At the same time, there's no question that people are learning. So if you look at the pre-aware population, the value of R is pretty high because they, in fact, aren't wearing masks or not doing things that self-protect. And so there is learning that's happening. And so you want to account for that, but not doing it in such a way that you're overfitting the model. And we need to, at some point, explain how we, a little bit more at the technical details, how we're trying to create that balance. But it is a balancing act.
Yeah, because Marlene also says, since the virus is so new, the parameters that you're using in your model are probably also very uncertain.
Yeah.
It may indeed show a very good correlation, but maybe that's only because it's actually covering something else. So our question is, since this is such new virus, we know very little about the model parameters. How sensitive are your outcomes to these uncertainties?
So basically everything up through the epidemiological model has been very stable. I mean, we made this change to account for the time variation in the relationship between R and social distancing. So, but that's really the only fundamental change we have had to make. The SEER model, it is just the nature of the way of these models. They are pretty sensitive to new data, to assumptions about what's happening. Now there's so many, we do a lot of modeling of the data, I guess you could say, before we actually put it into the model. So the SEER model is not based directly on reported cases and reported deaths. The model is actually built around infections and an infection fatality rate, and those things are much less sensitive. They are obviously, things are changing very quickly, but there is a lot less noise. They're a lot less subject to changes in how people and governments are responding to this. Things like reporting changes are the obvious one there. But yes, I mean, when you get data that shows that R has been rising in a state, and especially when it has risen across that threshold from 0.99 to 1.01, all of a sudden, the outcome 6 months out is going to look very, very different. And because we are typically carrying current conditions forward, there is quite a bit of sensitivity to whatever is going on right now.
Yeah, the value of R, the replication factor, that's the key value. And so, that's why we spend so much time on the estimation. But there's no question. I mean, it's being above 1 versus below 1 is extremely important. It's one reason why we are forecasting at this point 2 months out. That's partly because state governments, that's what the type of horizon that they're using for doing their own policies. But it also means that we're placing 0 probability of a vaccine being available or a serious therapeutic being available during those next 2 months. If we project out further, the confidence intervals, of course, get a little bit wider, but we would want to start to place in some probability of some type of therapy and at some point some vaccine, coming online.
I think you're already starting into answering this question, but now you have this model. How are you going to use this model? Is this something you're going to suggest to the government, or are you suggesting some policies? What are you planning to do with it?
It's already being used by governments in the United States. A lot of state governments, that's where the reopenings. For the most part, the state governments are where is the local area that decides business reopenings. It's even though the federal government, the president, had certain protocols a few months ago, it was never clear what the legal basis for that was. There's clear legal basis at the state government level for that. So it's the state governments that have been the main consumers of this. But more recently, some other governments have outside the United States have reached out to us to see if they can use the framework. And so we're eventually going to package everything up. We're going to present this in Washington at the Brookings Papers and Economics Activity in September. By that point, hopefully we'll have a GitHub website set up, and we'll also talk about more about the validations, more about the control and treatment, how do we deal with the overfitting, underfitting, and so forth. Our biggest failure right now is that we are not showing as much documentation right now, partly because there's been enough excitement about the model that we've gotten enough requests that we're just kind of overwhelmed with that right now. But what we're trying to do is document that better before we, and then we'll start posting code for other people to use. The hope is that this doesn't just become a COVID model; it becomes a framework for the next virus and for a way of kind of thinking through some of these things. So, I mean, in the future, if in fact we had this type of planning ahead of time, it's probably the case that a full quarantine is probably suboptimal. In particular, once you have the age structure bias of the virus, so COVID, as we know, is age biased toward older people. H1N1 is just the opposite direction. Once you have those key parameters in there, you could actually have done much more directed policy controls than maybe full quarantines. And the hope is a framework like this can be a little more suggestive ex ante to help policymakers prep a little bit more ahead of time.
Okay. I think we already covered most of the questions. If people still have questions, feel free to ask. One is coming in at this point, because the other 3 questions that we still have are already mostly answered. Gilles is asking, is it possible to model interaction between viruses? If this is possible at all, I am not a virologist. For example, where individuals infected by the regular virus is coming fall, a regular virus in the coming fall are therefore more prone to be infected by COVID-19. In addition, these individuals may be at increased exposure with infected individuals.
I had not thought about the interaction between cold viruses and this. We have thought a bit about reinfection. I mean, the issue of reinfection of COVID. The word on the street typically is that even if the virus mutates a bit, reinfection is possible. Exactly how contagious is that person, but also if they survived it the first time, they're highly likely to survive it the second time, unless it's a serious mutation. But the big issue is what is their ability to be contagious themselves, and that's kind of an open question. But I've not thought about the interactions between a cold and and the COVID. Have you, Alex? Do you have any thoughts there?
So, it is somewhat implicitly reflected in the seasonal and temperature effects we have on the infection, just because those are closely related to the spread of these other, of the flu and of the cold, a common cold. But no, we have not done anything explicitly. I mean, again, it's sort of some of that effect is going to get picked up by controls for comorbidities. But nothing explicit here. It's an interesting question of how, I mean, I guess as I think the question suggested, this is a virology question of how significant this is. So hopefully somebody who actually knows about that stuff will tell us whether this is an important dimension we need to account for.
But there's no question that the flu right now, the non-COVID, just the standard flu is the flu season is pretty bad in the United States right now. Estimates are about 60 million people, around 60,000 cases, 60,000 some deaths this year will probably happen just from the common flu. So you can imagine if somebody, and that also hits, typically it's older population too, that is most at risk for the flu, at least in terms of potential for death. And so if they get the flu, they're weakened from that, and then they get COVID on top of that, that would be, that could be pretty serious.
Great.
Okay.
Julia, I have one more question, and Ken and Alex, more a general experience. If you look back now, we were talking a lot about the model itself, and you have a lot of experience in modeling. So what is the biggest difference you had with the COVID modeling or the combined between a virologist model and an economic model? So what's your experience? Did it change the way you modeled? Did it change something, the availability of data or the data science in general around it? So just a general experience compared to other models or topics that you modeled.
Other topics that we've modeled, or other like epidemiological only models, or
no, that you modeled and saying, okay, it was just another challenge, but all the general challenges or pros and cons around modeling apply equally here? Or do you think through that, let's say, global phenomena, there was something that advanced the whole practice of modeling? Or
so
that's a good. Go ahead, Alex.
So I mean, this is sort of indirect, but I mean, you know, one huge change that is critical to our project is the availability of all of this new data that mostly private companies have been making public. And I mean, this is like, this is data that contains value and interesting information well beyond COVID. But unfortunately, probably it will not continue being available beyond COVID, but you know, we are getting just an incredible look at mobility patterns, at where people spend time, how they move around, that I think, you know, you would have had to pay a significant amount of data, a significant amount of money to collect all the data that we've been able to get, you know, publicly available. I think as far as the methods, you know, we approached this with our economists' mindsets. And so, you know, the empirical methods we're applying here are very much straight out of empirical economics. I think, you know, getting into the SEER modeling, the epidemiological dynamics, was a very new topic, but actually not very different from a lot of the models that we work with in economics. I think this is why you have seen so many economists jump into this, is sort of they look at what the epidemiologists are doing and they say, oh, we've done this before, we know how this works. So, you know, and I mean, I think that it's been, it's very different from stuff that we've thought about in the past. But basically, we are taking methods that we use in other contexts and mapping them into this context.
Yeah, in terms of data, so our models that we typically use for analysis in the United States are typically very structural, in the sense that we're talking about computational dynamic programming type models. And so, you know, we're often use thousands of processors simultaneously, things like that. And that data comes from social science data that often surveys that the government sponsors, as well as government data itself, tends to be much more low frequency. By that we mean, you know, at most quarterly, you know, data is what we have to worry about. Here we're talking about daily data, which is very different. And the fact that the private sector has just been so, you know, open and generous with making that data available. Like Alex said, sometimes these data sets, if you try to bribe one of these companies to give it to you, and not only you have to go through all sorts of lawyers and licensing agreements and things like that for how the data is going to be used, not to redistribute and so forth. But companies have just really opened up and they've made this data very accessible. And so it's, you know, that part's been really wonderful. And in terms of the modeling itself, a little less structural, but again, a little bit more, you know, flexible in that sense. But of course, always the problem when you go less structural is you always want to make sure that you're not overfitting things as well. And so that's always the trade-off. But, you know, at the same time, people are changing their behavior quite a bit. And so you want to capture that. So that's always the trade-off about that flexibility versus making sure that you're being kind of real fair about it and trying to minimize that mean squared estimated error going forward, by not overfitting.
Thank you.
Mark, do you maybe have another question you'd like to ask?
Not anymore, I think. I think it was very clear, very nice presentation. I'm very happy to follow up also on this, and I will do that by private communication. And I really appreciated it. And probably if there are no more questions left, we've come to the end almost, I think. Eh? Or do you see in the Q&A a few more questions? I don't think so. Now I want to thank Kent, you and Alex very much for a very interesting presentation. And yeah, looking forward to hear more about this. Bye-bye.
Thanks for the invite. Bye-bye.
Bye-bye.